Oftentimes people want to know what to expect the day of surgery. We've worked really hard to make your experience as seamless as possible and make sure it's efficient. We typically expect people to be here about an hour and 15 minutes on the day of surgery. You get checked in, paperwork, and all that's taken care of. And then we use 2 different types of anesthetic drops to make sure the cornea is nice and numb. That keeps you comfortable throughout the whole procedure. There's some antibiotic and steroid drop we use as well that just helps prep the eye for both before and after surgery. And then some of those other tests where we check the prescription power and take some maps of the cornea to give the laser all the information that it needs to be able to perform the treatment. Surgery itself will take about 7 minutes. We have 3 different lasers at Durrie Vision that we use to create the flap for LASIK, which is nice because it gives us a chance to customize the flap to your specific shape or power treatment that you need. Each laser is a little different, but in general, you lay down on a bed, make sure you're comfortable, eyes are numb. With those anesthetic drops, we have you look up at some lights as a target, and then a little instrument just gently spreads the eyelid open so you don't have to worry about blinking in the midst of it all. Then you watch either a green light or a ring of white lights, and the laser will take just seconds to create this thin, protective, customized flap. After that, we'll move you to a second laser, and again, in a matter of seconds, that's able to change the shape of your cornea. Immediately after the procedure, we take you back to the same room you were in beforehand, gather your belongings, we give you some instructions on how to care for the eye that day, we instill a few different drops, we instruct you how to use the artificial tears, and then we run over some specific details of what to look out for in terms of day of surgery. The surgeon will also come and at the microscope, take a look at the eye, make sure that everything looks just as it should before you go. But typically after surgery, once you're home, about an hour and a half afterwards, the vision really starts to improve, and it improves by about 10% each hour. It'll be a little foggy, you'll see little glow around lights for the first day or 2, but oftentimes in as quickly as 4 to 6 hours, people will be reaching 20/20.